Hi, welcome to Healthy Living. So we want to talk about October and Breast Cancer Awareness Month in this episode of Healthy Living. I have three fantastic guests with me, and we want to talk about what we like to talk about: education, screening, and prevention. So we have a campaign every October. It's called United in Breast Health, the Power of Pink. So I just want to talk about that and the opportunities and resources that we as St. Tammany Health System have for you. So with me, my first guest is Tiffany Raiford. She is our Director of Imaging Services. So Tiffany, thank you so much for joining us.
Thank you. It's always a pleasure.
Yeah, so you've been on this show before, but I would love for you to tell our viewers, whoever might be new to watching, a little bit about you and what you do for the health system, and if you want to share something personal, that too.
Yeah, so I am the Director of Imaging Services at St. Tammany Health System. I started there in '97 as an X-ray student and did lots of things: X-ray, MRI, CT, and now I am Director of Inpatient and Outpatient in the Women's Pavilion Breast Imaging Services.
Yeah, so you've seen quite an evolution as far as imaging technology.
Yes.
Through the years, correct?
Yes.
So it must be worlds of difference between now and 1997.
Oh, yeah.
Yeah. So we're talking
days of running film, and now everything's digital. And,
right, and we get our results instantaneously. We were in a conversation together with another colleague, and we were talking about that, how you used to have to wait a week for your results, and now you can get them instantaneously. So that's a plus for everyone involved. But today we're specifically focused on Breast Cancer Awareness Month and breast health. And in my view, we offer a lot of convenient options for women in the community to get their yearly mammogram screening. So can you elaborate a little bit on how anybody can do that and the options that we do offer?
So anybody, it's recommended anybody over 40 has an annual mammogram. We have the Women's Pavilion, we have the Mandeville Diagnostic Center on St. Anne, and then we also have the Be Well bus, which I won't steal Anne's thunder later, she'll talk about that, which is all over in the community.
Yeah, so as far as that goes, we talked about this earlier this morning, really, about, you know, if you haven't had your first mammogram yet, it's a little bit of a mystery about what to expect. Because women classify it in different ways. You know, some people say, oh, it was the worst thing ever, it was so uncomfortable. And others are like, oh, it was no big deal. So what can someone expect if they haven't ever had a mammogram? What can they expect from their mammogram the first time?
So the myth is it's very painful and you're just being squished. And that may have been true long ago. With technology and the compassion of our certified mammographers, it's a few seconds of uncomfortableness, but it's not painful at all. A lot of women that have their first mammogram and come in scared to death, and they leave saying, oh, that wasn't bad at all. So, I mean, it's not the most comfortable thing, but it's, you know, a few seconds of, you know, just a slight discomfort that could save your life.
So you just said that. It's like a couple of seconds of discomfort that might save your life. So let's kind of talk about why a mammogram is so important and what it does to detect and possibly catch breast cancer early and maybe save lives.
So with the 3D technology, which is called tomography mammogram now. So it used to be just one flat picture, kind of like comparing a CAT scan to an X-ray.
Right.
The technology now takes slices of the breast tissue where the board-certified, fellowship-trained radiologists can look through the breast instead of just like a plain, two-view X-ray.
Yeah.
So it's like a CAT scan of the breast.
Wow. And so you can see changes that might occur and catch those early kind of abnormalities, if you will, in a mammogram situation.
Yes.
And when you talk about 3D technology, why is that important? Is that something every facility has in the area?
It is not. So it's very important when you're scheduling your mammogram to ask those questions. Do you have 3D? Do you, what kind of equipment is, we are accredited with NAPBC. We're a Breast Comprehensive Center of Excellence, which means we have to go through a lot of required stipulations, and a lot of work goes into that accreditation, and it's something to be very proud of. Our equipment is tested, our credentials are tested, everything is scrutinized to get that accreditation, and it's an honor.
So we talked about this yesterday briefly. You mentioned this, and I thought it was very intriguing. You said that there are people who come in and they ask for the tech that they had the year before because your team forms relationships with the people that they serve.
Yes.
So can you talk a little bit about that?
Yeah, so we have a lot of tenure in our staff. Most of them have been there a long time. And we do have women that come back annually and ask for specific techs. We've had, our nurse and our technologists, even our radiologists have sat and cried with our patients and walked them through their entire journey.
Right.
As a comprehensive breast center, you can get your screening done all the way through your diagnostic, your biopsy, your treatment with our high-risk breast clinic, and stay there, for the entire thing.
So when we talk about that, we're talking specifically about the Women's Pavilion, correct? Mm-hmm. Because that is a very unique facility in that it's really like a spa when you walk into the Women's Pavilion. It's lovely in there. It caters to women, Women's Pavilion, but then adjacent to the Women's Pavilion is the high-risk breast clinic. So you have all of those services, the continuum right there.
Right.
So
within the Women's Pavilion, we have mammography, breast ultrasound, we have breast MRI, as well as physical therapy. And then next door we have Dr. Bonagera, Melissa Varnado, which is our nurse practitioner, and a new doctor, Dr. Chris Porter.
Okay, that's fantastic. So let's talk about, so you get your mammogram, and your physician says, okay, we've detected something on your mammogram. The second step for that sometimes can be an ultrasound, but it can also sometimes be a diagnostic mammogram. So can you kind of talk about the difference between your yearly annual mammogram screening and a diagnostic mammogram?
So your regular screening, annual screening, you go in, you get it done, and you're out. A diagnostic, if anything shows up on that screening that's abnormal, they may want you to come back for a diagnostic mammogram. And that's almost like taking pinpoint pictures and zooming down on the area of interest. And then it's usually comprehensive with an ultrasound. And then after that, you do see the radiologist right away, and they go over it with you. So you're able to get that reassurance or that comfort of knowing that day if there's something that needs to go further, or if everything's well and you just follow up in 6 months, or you go back to annual.
Right. So that's an important piece to know the difference between a screening and a diagnostic mammogram. And to know that our technology is the latest, we kind of touched on how far technology had come, but what would you say, the difference between now and just 5 years ago in the technology?
So I think it's been 2 years since we have purchased our stereotactic biopsy table. So which is, it's kind of like you're laying on a massage table, and the biopsy is done from underneath, and simultaneously the sample is x-rayed through a tube to where they're making sure they got any abnormality they wanted out of there.
That's amazing.
To ensure a good biopsy.
Yeah, so the technology is rapidly changing, it's constantly changing, and it's changing in favor of the patient, right, to make it easier and more
faster and
precise. Yeah. So we want to talk about the importance, we want to stress the importance of your annual mammogram once you reach a certain age. And really, we recommend that you work with your primary care physician to determine what the best age is for you. Recommended is 40, at the age of 40, but some women need it earlier based on family history and other things. So we recommend that you talk with your primary care. So we wanted to establish that first. But let's talk about why that annual mammogram is so important and how that history kind of stacks up through the years.
Yes, so 1 in 8 women are diagnosed with breast cancer without family history. 75% of women do not have family history. So it used to be a big family history, thing, and you'd go get checked. Lately, it's nothing, no rhyme or reason to it.
Right.
So anybody can get it, and the difference between early detection and finding later could mean the difference of minimal invasive intervention needed, surgery, treatment, and then it's done, other than spreading all over your body.
Yeah. So it's just a few minutes of an appointment, we'll call it. We're not even going to classify it because it's different for every person.
Right.
But it does a lot to inform you about your health and what the next steps are. So
one thing I did want to note is you do not need a physician's order. So you can either call the Women's Pavilion, the number 773-1500. You can go on My Chart. You do not need a physician's order. You can self-refer for a screening mammography and get it done at any of our locations.
And that's for your annual. Okay. And we always recommend that you check with your insurance and ensure that it's covered. But generally, most insurances do cover that screening mammography within the guidelines and the recommendations of your physician. So is there anything else that you would like to add about what services we provide for women, and especially during, well, I did want to mention this. We talked about this earlier too. don't wait till October.
Yeah, please don't.
Get your mammogram when it's due,
Yeah.
right? We highlight it in October.
Yes, we
but
do.
Go on.
We do. So we have same-day appointments. We typically don't we try to stay away from the walk-ins, so we have same-day appointments. We also have Saturday offerings at the Women's Pavilion. Ann will talk about the bus locations, but I know the big hype comes in October, but anywhere throughout the year. So if it's easier in the summer for women or whatever,
right?
Just anytime.
Okay. Is there anything else you want to add? Well, we so appreciate you being with us today. Thank you for that great information.
Appreciate it.
And everyone, please stay tuned because our next guest is going to share with us some ways that you can get involved with St. Tammany United and Breast Health, the Power of Pink. We'll be right back.